Okay, so I'm going to, it's my great pleasure to introduce our first keynote of this conference, Dr. Razieh Nabi, who is a Rollins Assistant Professor at Emory University School of Public Health. She happens to be my alma mater, but a few years younger. And she's taken an interesting journey, as described in her bio. So she has an engineering background in aerospace engineering, and then gradually shifted to electrical engineering and then statistics. So her expertise is in missing data and causal inference with interference and artificial intelligence, and kind of the intersection of all those exciting areas. And she works on substantive areas in public health and criminal justice. So without further ado, I will pass the baton over to Razieh.
Hi, everyone. Thank you so much, Sahar, for the introduction. It's a pleasure to be here. Okay, let me share the screen. Is everything okay?
Yes.
All right, great. So yeah, thanks so much for inviting me. It's an honor to be here. And I wanted to talk about some ways to think about how we can use causal and counterfactual thinking in order to address various sources of biases, especially in observational data, and how those biases can impact these algorithmic models and how they're going to be used in decision making, and what are some of the ways we have to be aware of, and try to make sure that these biases are not being perpetuated. So we know machine learning algorithms are becoming more and more integrated into various aspects of our lives, and really transforming how decisions are being made in various domains like healthcare, medicine, finance, retail, and many others. So the thing is, what machine learning does at heart is finding patterns in order to gain insights in what's going on and how we should make decisions in these domains. But the thing is that these patterns are often based on spurious correlations. And the problem with the spurious correlations is that they are not really robust to perturbations or interventions. And that's problematic when it comes to using these algorithms in decision-making settings. A classical example is in image recognition, where the training model uses tons of images of cows chilling on grass, and then we take the cow to the beach, and then the algorithm doesn't recognize the big elephant in the room. So what happens is that machine learning is finding these patterns based on the greenery surrounding the animal, and that's why when we have perturbations to the environment, then machine learning fails. So it's based on the fundamental assumption that machine learning makes, that training algorithms, the training data basically is representative of the test data that is going to be that the algorithm is going to be deployed and used in. And there are other examples when we are looking at images from a different angle and some tweaks. And when I saw these examples at the beginning, I thought these are hilarious, but they are less funny when we are thinking about deploying these algorithms in crucial settings like healthcare. So let's look at an example and why making decisions based on patterns could be problematic. So here we are looking at survival time among patients who are infected by HIV and are being treated by antiretroviral treatments. So we are looking at survival time as a function of time to treat, and we see this positive relation between the two. So then we want to make this decision on whether we should treat individuals immediately or not. And based on this plot here, we can see that those who are being treated immediately have shorter survival time compared to those who wait to get treated. So then maybe the decision based on this plot is to do not treat immediately individuals who are being diagnosed with the disease. But then if we stratify the population and look at the severity of the disease based on, for example, low, medium, high, and then we see that this pattern changes direction. For example, if you look at the blue dots that show the high severity of the disease, we can see that those who are getting treated immediately have longer survival time compared to those who wait. So then the decision based on this plot is to treat immediately. So this is a classic example of confounding that teases apart correlation from causation. And here the severity of disease being a confounder that impacts both the treatment and the outcome that we are interested in. So this phenomenon is also referred to as Simpson's paradox, where the directions of correlation changes when analyzing the whole population as a whole versus looking at subpopulations. And it's not just about changing the direction, but it also confounding bias could affect the magnitude of the effect that we are interested in as well. So then how do we properly get rid of this confounding bias is through this gold standard that's known as randomized control trial, where we look at the study population, we randomize people to two groups. When we give one group the treatment and the other group receives the alternative treatment or the placebo, we follow them up and then compare these two groups and find the effect that we are interested in. So by the fact of randomizing people into treatment arm and control arm, we kind of get rid of these confounding bias by design. But the problem is that we cannot run randomized control trial all the time for a variety of reasons. For example, if you're interested in whether smoking affects lung cancer or not, we cannot randomize people and force them to smoke versus not. Or there are other concerns like financial restraints and time complications. So what happens, people then try to use observational data and try to emulate this randomized control trial in order to draw inferences that we are interested in the decision making. So that's what motivates my research. Is the overarching goal of my research is developing data-driven causal methods to support informed decisions and come up with better treatment and policy interventions. And doing so mostly from using observational data. So my methodological insights come from both machine learning and AI, especially using powerful tools like graphical models in order to encode certain assumptions about the underlying data generating mechanisms, as well as using statistics, non-parametric and semi-parametric statistics, in order to come up with informed decisions in settings, especially that require precision and quantification of uncertainty. And in doing so, we face several challenges, one of them, of course, being the confounding bias, but there are also other challenges, like if we have informative missing and censored data, as well as when we are looking at data that basically reflect historical patterns of discrimination and inequalities in our society. So today I'm going to talk about each of these briefly, and I'll start with the confounding bias. So a typical causal workflow looks like this. We first start by writing down the question that we are interested in. It's the causal estimate. It's often written down in terms of counterfactuals and potential outcomes. And then once we have this estimate of interest, then we have to make assumptions and define a causal model that links this counterfactuals and potential outcomes to factual variables that are observed. So it's basically encoding assumptions for identification of this causal estimate as a function of observed data. And then once we have the identification, once we know what functional we are trying to estimate, then we define a statistical model. So how do we use finite sample to basically estimate this functional parameter that I'm interested in, or this specific parameter that I'm interested in? And that involves doing tests, doing estimation and inference on the magnitude of the causal estimate of interest. And then along the way, we are making assumptions here and there. So then the last step is how our findings are sensitive to violations of these assumptions and doing sensitivity analysis, basically. So I'm going to go over a quick example with this causal workflow. So the simplest causal estimate of interest is the average causal effect. Let's say we have a binary treatment. So what we're trying to capture with this average causal effect is a comparison between two potential outcomes, Y1 and Y0. It is superscript 1 and 0, where Y superscript little a basically denotes the potential outcome had the treatment was assigned to little a. So it would be either whether the individual hypothetically received the treatment versus didn't receive the treatment. So this is our estimate of interest, but it's a counterfactual quantity. And the question is, can we use observed data to infer this causal effect? So then the second step is defining the causal model that relates counterfactual to factuals, and there are many different ways to do so. I'm personally a fan of causal graphical models to encode these assumptions, and the simplest form being a directed acyclic graph, or DAG for short. And here's a simple example of 3 variables. We have the treatment A, the confounders X, and outcome Y. And the causal model of the DAG basically assumes that each variable is a function of their direct causes or parents on the graph, plus some error terms. And the non-parametric structural equation model, this is a common causal model that is assumed for graphical models. It assumes that these error terms of these different variables are mutually independent. So the causal model of this particular DAG implies what's known as the conditional ignorability, that these potential outcomes are independent of the treatment given the set of confounders. And plus some standard other assumptions, we can write down this counterfactual parameter of interest, this average causal effect, as a function of observed data in this form. When we are looking at basically outcome differences between the treatment group and the control group, and adjusted for the set of confounders, and then average over these confounder distributions. So this is known as the G formula, the backdoor adjustment, or simply the adjustment functional. So then once we have that, the next question is then what is the statistical model, and how we would go about estimating this quantity. So for estimation, we would need replicates of the covariance, the treatment, the outcome, and then the statistical machine learning models. So if this is the parameter of interest, a simple estimator would be a plug-in estimator where we would just estimate the outcome regression, denoted by mu here, so an estimate of it is mu n. So we would be looking at the difference between outcome regressions when the treatment is set to 1 versus set to 0, and then doing an empirical mean over the finite sample that we have. So there are a huge literature on how we go about proposing different estimators for this parameter of interest, techniques ranging from inverse probability weighting, matching methods, Bayesian methods, some marginal structural models, structural nested mean model, and so on and so forth. And my favorite ones are the ones based on semi-parametric influence function theory, like the augmented inverse probability weighting, that kind of enables us to use flexible machine learning models in our estimation pipeline in causal inference, while having this desirable statistical properties like root inconsistency, asymptotic normality, and robustness to model misspecification, as well as efficiency, of course. And then the last step is sensitivity analysis. So one big question here is just, what if this set of confounders X actually don't capture all the confounders? Or what if some of the confounding factors are not actually measured? So then what happens then? So if you have unmeasured confounders that affect the treatment and outcome, then this adjustment criterion is guaranteed to fail. And this is kind of very common in observational study to have unmeasured confounders between the treatment and the outcome of interest. But then a simple generalization of that is that whenever we have unmeasured confounders between the treatment and any variable that mediates the effect of the treatment on the outcome, we can no longer use the adjustment functional. So then what should we do in those kind of scenarios? So there are a variety of ways to handle unmeasured confounders. One set of approach basically depends on interval identification. So instead of trying to point identify the parameter that we are interested in, we try to find bounds for this parameter. Sometimes the bounds are indexed by a sensitivity parameter, sometimes they are not indexed by a sensitivity parameter. And then another way to approach this problem is again point identification, but making some assumptions about the counterfactuals and factuals. So it's point identifying the parameter of interest as a function of a sensitivity parameter. So when we look at different ranges of this sensitivity parameter and see how the effect varies. And then there are also approaches based on parametric and semi-parametric assumptions, so make the model more restrictive. And there's huge literature on, for example, linear structural equation models, where we assume the relation between variables are linear, or methods based on instrumental variables, and many others. I've worked in this area a little bit myself, like when trying to look at point identification that are indexed by sensitivity parameters. But then what I want to talk about now is thinking about three different kind of questions or sets of questions that I'm interested in this area. One of them related to confounder selection. So let's say we are interested in the effect of a new drug on recovery time, and we have access to this information related to hospital quality. And then, so we knew hospital quality could be impacted by socioeconomic status as well as health literacy. For example, depending on individuals' income, then they may have access to different hospitals, and based on their literacy, they may do their research and to find a doctor with the right set of skills in the right place. But then socioeconomic status could affect also the choices of drug, what drugs they would have access to, whether they would have a specific type of insurance, and what their income status is, and all those things. But health literacy could also impact recovery time. So they could do a lot of research on their own on what kind of diet and lifestyle they have to pursue in order to recover faster. But we may not have access to socioeconomic status data as well as data on health literacy. But using traditional notions of confounding in the statistics, one may think that we should adjust for this variable related to hospital quality in order to infer about the effect of this new drug on recovery time. Because in traditional statistics, one would think that a confounder is the one that is correlated with the treatment and is correlated with the outcome. And it's a pre-treatment variable. So health hospital quality here satisfies all these conditions. And then so we would think that, okay, we should adjust for this hospital quality variable. But then in reality, we should actually not adjust for this because of this specific structure known as the collider structure, that if we do adjust for this variable X, then we open up a spurious pathway that we didn't that we shouldn't have opened up. So if you know about the structure of the data generating mechanisms, we would know that this is not a proper confounder to adjust for. So this example is a classic example known as the M bias because of this shape of an M. And it's unfortunately in a lot of applications, people are not aware of this fact, and they tend to adjust for whatever information they have, which could be problematic in some settings. So one type of question that I'm interested in is looking into like what kind of confounders could be hurtful, or could be neutral. And sometimes even we might have different choices for adjustments. So thinking about questions of what adjustment sets are best, and there are different notions of what it means to be best. One thing that I'm interested in is in terms of efficiency. So which set of adjustment variables would give me an estimate with a lower variance, would give me an unbiased estimate with lower variance. And all these kind of questions also relates to the so-called causal structural learning and causal discovery when we are trying to learn the underlying graph basically from data itself. So the second type of questions that I'm interested in is again relates to unmeasured confounders, and it goes as follows. Let's say we are interested in the antiretroviral treatments on some HIV-related outcome like CD4 counts, and we have measured confounders X. So then the effect here is going to be identified through the adjustment functional, and we have the identifying functional and a lot of estimation choices. But then in reality, again, we could have a lot of unmeasured variables related to the treatment and the outcome. In that case, the effect would no longer be identified. But then maybe we have some extra information in our data that we could leverage in order to identify this causal effect. For example, we could have a mediator or a rich collection of mediator variables that mediate all the effect of the treatment on the outcome. An example of this is when we are looking at vaccines, and we know that that vaccines affect the outcome through antibody responses. So And then because antibody responses are also a biological thing, then it may be easier to reason about how unmeasured confounders could affect these antibodies as well. So if you have these sort of information, then the effect is again identified not through the adjustment functional to a different functional, but still it's going to be identified, and I can use observed data to estimate this parameter of interest. But then we could have multiple mediators, we could have varying confounding behaviors between the exposure, these mediators, and the outcome. But the question is, in a given model, in an arbitrarily graphical model with hidden and unmeasured variables, can I identify the effect? And if so, how would I go about using data to estimate this effect of this identified functional of interest? So I'm very interested in that those kind of questions. There has been a lot of progress in at least in terms of non-parametric identification, but not so much on estimation. So the real question is, how do we use data in the most efficient way to draw inferences about these kind of parameters in these arbitrarily graph representations? And then lastly, what I'm really interested in this area is looking into complex exposures. In causal inference, we primarily look at exposures that are binary. Did you receive treatment versus did you receive placebo, or continuous exposures when we are thinking about different dosages of a drug. But then in some applications, we could have way more complex exposures. One application is in radiation therapy. And the thing is that radiation is often represented through this 3D voxel maps of radiation dosages. I had looked into radiation therapy as an exposure of interest in head and neck cancer patients. And it's very complicated because we have these 3D voxel maps, but then those maps are also just like are shown for a specific structure and a specific gland in head and neck areas. And it's just a very complex exposure. But then there are also ways that people look into summarizing this data, for example, by looking at X percentages of a specific gland receiving Y percentages of the radiation. But even in these kind of summarizations, the treatment is relatively high dimensional. So then the question is, how do we even think about the feasible causal inference to get to the effect of radiation therapy on a specific health outcome that we are interested in? Another application that I recently got involved in is thinking about air pollution as the exposure of interest. So air pollution mixture is also a complex exposure, and because it's represented via a vector of individual pollutant concentrations. So then here the question is similar. We want to know what is the effect of this complex exposure on some health outcomes, some respiratory or cardiovascular outcomes. So a lot of the times, and when we hear about high dimensional object, we think about dimensionality reduction, and the idea is, why not pursue that sort of idea here as well? Okay, so the suggestion is to reduce the dimensionality of the this complex exposure, but it's not as simple as using, for example, principal component analysis and variations of it, because we need to account for two different things. One is, what is the exposure outcome relations, and the other one, what is the relation of the exposure and outcome to the confounders. So we have to adjust for confounding factors as well. So a naive application of PCA wouldn't work, but then the question is, how do we actually do dimensionality reduction of these complex exposures that would preserve the effect that we are interested in? So I have looked into using marginal structural models, but there are still a lot of interesting problems and subtleties that need to be looked into in that regard. I'm not sure if you're leaving the questions to the end or not, but if you have any questions, please feel free to interrupt me. All right, so let me move on to the second part related to missing and sensor data. I have only a couple of slides on this, because I want to get to the discriminatory biases as well. But the
Yeah.
so
Sorry, I had a question actually. Could
okay.
you, could you please elaborate a little more on these complex exposures? Just maybe you
Yeah.
provided some context, but what if we don't reduce the dimensionality? What is
Yeah.
the alternative?
So so um so so the complex exposure is very complicated to think about, like what is the effect that we are interested in. If you have a binary, for the effects, we are always thinking about contrasting one potential outcome to the other. So did you receive the treatment or did you not receive the treatment? But in radiation therapy, when we have this high dimensional exposure, it's very hard to think about these contrasts. Like what does that mean to even think about receiving a specific type of radiation, a specific radiation dosages versus something different. So it makes natural sense to think about dimensionality reduction. Maybe there are other ways to try to come up with a framework that deals with these complex exposures, but this is what what I thought of. But then I thought that, okay, so but it's not as simple as regular dimensionality reduction technique. You kind of have to be more careful because it's a causal effect that we are interested in. It's not a simple correlation.
I see. So it's mostly on the implementation that that it might, or is it more like an issue of implementation or interpretation? Because I feel like with the interpretation, we would by necessity redefine the question a little bit, maybe like dichotomizing the exposure and saying, all of these are going to be considered exposed, all of these scenarios are going to be considered unexposed, which would change the question a little bit. But I guess my question is, if one is okay with that interpretation, are there additional challenges with the implementation, or is the big challenge in justifying
I
if that interpretation is correct?
Yeah, I think like in terms of implementation, it depends on how complex the exposure is. Like you are thinking of, okay, dichotomizing the exposure, but there are infinitely many ways to dichotomize like a high dimensional exposure. So then, yeah, it's kind of like combined and entangled, like the implementation as well as the interpretation. Um, so it does make sense if I'm looking at the a single dimensional continuous exposure to just like say that, okay, if exposures are graded at a specific level, then I treat them as the treatment versus if they are lower as the control. But then I don't have that kind of luxury when I am looking at, for example, 500 dimensional exposure or something of that sort.
Okay, thank you.
Yeah. All right. Okay, so moving on to the second part on missing data, I would just like want to say that the way I was taught causal inference is through missing data, that the causal inference is a missing data problem, because there are a lot of similarities in the terminology, in theory of identification and inference. So the question we are interested in causal inference is a counterfactual question. What would have happened if the person, if something was different, if the person, for example, received a different type of treatments? And as the question is similar in missing data, if you have missing values, we want to know what would have happened had there not been missing values. So it's sort of innate in nature. It's a counterfactual and causal question. So this goes both ways. So there has been work that shows that causal inference is a missing data problem, but there also the converse view that missing data problem is a causal inference problem. And what I wanted to do in this area is to try to use causal some developments in causal graphical models to better reason about missing data, because in missing data, there's this traditional Rubin's hierarchy of missing completely at random, missing at random, missing not at random. But then it's a little unclear what the underlying missingness mechanisms would look like relating to each variable itself, and kind of deploying some of the modeling through graphical representations gonna guide us a little bit better how we would handle and how we would even categorize different missingness mechanisms. So here let's say we are interested in the effect of, for example, smoking on bronchitis, a type of lung cancer, and we say that the effect goes through tar accumulations. So we are looking at observational data, we have unmeasured confounders, but assuming that the tar accumulation mediates the effect of smoking on bronchitis and is not influenced by the same sources of unmeasured confounding, then we can write down an identifying functional for this. It's known as the front door functional. It's different than the adjustment functional. But then at the end of the day, it's a functional observed data that we want to estimate. So in order to estimate this, we need replicates of the treatment, of the mediating factors, of the outcome. But then when we look at data, we see that we only have proxies of these variables. In other words, when we look at the rows, we have question marks for a selection number of variables. So that the question is how we would use this data then in order to estimate this parameter that I'm interested in. And the parameter that I'm interested in doesn't have to be a causal parameter. It could be anything. Should I just ignore these missing these question marks and look at only data with complete cases, or not? Or is there a better way to handle that? So the very first question I have to ask is, why do we have missing values in the first place? As I mentioned, there is just like this traditional hierarchy of missingness depends on observed values, or is it completely at random, or depends on something that is unmeasured, or something that is only partially measured. So in the first step, we to reason about why we have missing values, we could introduce this missingness indicator. So augment the data with the missingness indicator related to each variable. And it says a binary indicator. If the value of the variable is observed, the missingness indicator would be 1. If it's question mark, for example, it would be 0. So what I'm very interested in is the reason about missingness for each variable, and think about what are the causes of the missingness for each variable. So what we would be doing is really augmenting the graph that we already have by including the missingness indicators on the graph as well. And we know that the proxies would be just deterministic functions of the underlying variables and their corresponding missingness indicators. But the real question is how these missingness indicators are related to one another and how they are related to the underlying variables. So there is a lot of interesting questions in terms of identification and estimation under what assumptions I can actually recover the underlying distribution, and once I have that, how do I go about estimation? But in practice, it's also a very hard task to reason about causes of missingness for each variable. So in practice, it often involves talking to clinicians for a long period of time, going back and forth. And what I have looked into is looking at personalized medicine for lung cancer patients when we are using EHR data. And there are a lot of information, baseline information on, for example, age, insurance, gender, race, a lot of measurements on baseline clinical information, but there are a lot of missingness there as well. So the question is, what are the causes of missingness? So it required talking to a lot of clinicians and incorporating domain expert knowledge to reason about missingness for each variable. And then once we have these graphical representations, then we can go about designing and developing really a procedure that listens to the underlying missingness mechanisms and try to complete the task at hand. A lot of the times when in practice, what I see is just people use imputation methods. And the reason for that is because I think there are very good packages that people can just utilize, but the problem with that is that they're not really thinking hard about what the underlying assumptions are, what the underlying missingness mechanism is. And that can be very problematic, and would lead to a lot of bias in our analysis. But I think with this line of work, we're trying to make the missingness mechanism very clear and then really devise the inference based on the missingness mechanism itself. I think that's it might be very high level, but that's all I'm gonna say for now for missing data. Let me move on to the last part, which is on discriminatory and unfair biases. There are no questions. Okay, so at the start of my PhD in 2016, there was this article that was published called "The Machine Bias" by ProPublica. And what they were looking at was assessing some risk assessment tools called the Compass that was used in courts across the country in order to give risk scores to different defendants based on their risk of recidivism. And what they showed is that there is huge differences in false positive and false negative rates among Black and white defendants, and they argued that that mounted to discrimination against Black defendants. That led to a lot of controversies, and North Point, who was the creator of the Compass risk assessment, published a very long response. And in their response, they said that ProPublica wrongly defines measures of discrimination. So this really brings up two main questions of why do algorithms introduce unfair biases and what is a good measure of unfairness. So despite their promise of objectivity, algorithms unfortunately introduce, reproduce, and perpetuate disparities because of their reliance on human beings really in every step of their developments, from variable collection, variable definition, to how our scientific findings are really put into practice as policies. And the thing is, if you don't want these algorithms to rely on sensitive information like race, gender, sexual orientation, etc., why not just ignore these information? But ignoring this information is neither necessary nor sufficient because of a variety of proxy variables that we could have in data. And as long as as soon as we start ignoring variables, we would just basically be removing every variable. So in fact, North Point said that they're not using race directly in their risk calculations, but we know that for example, in segregated neighborhoods, area code would be very highly correlated of race and could be a very good predictor of race. So then the question is, how do we actually so the question now is we would be asking two main methodological questions. The first one is how to express fairness principles mathematically, now that simply ignoring the information wouldn't work. So then what is the best way to mathematize and quantify what it means to be fair? And then the second question is, okay, once we have that notion of fairness, when we have that mathematical notion, then how to ensure statistical procedures actually adhere to this fairness norms. And because I was very interested in causal and counterfactual reasoning, so I wanted to approach this problem from a causal point of view as well. So I'm going to mostly focus on the first question because of the time constraint, but I wanted to say that even in answering the first question, there's just like a lot of complications. So first of all, the first question is about how to express fairness principles mathematically. So it very much, we have to very much be careful in what context we are asking that question, what it means to be fair with respect to a sensitive variable and outcome of interest. So broadly speaking, there are three algorithmic decision-making contexts. One of them is the predictive decision support, where we are making decisions only based on the model outputs. So this is considered a big portion of the fairness literature. And the second one is the prediction-assisted decision support, where we are using the model outputs, but as well as the personal judgments. So a judge, for example, is using the risk assessment tool, but at the end of the day, they are the ones making the decision. So this context is harder in order to basically ensure fairness, or almost impossible, because again, humans are involved in the process. But then there is also another setting that is more realistic than the first one, where we try to automate the entire decision-making process by having an outcome in mind that we want to optimize for, or having a utility function or a reward function. So this relates to dynamic treatment regimes in causal inference and reinforcement learning in machine learning. Again, it's more realistic than the first one, while we can still assure some sort of achieving fairness or satisfying these fairness norms. I'm going to talk about the first one here a little bit more in the first context, but the generalization to the last context is kind of similar. So there does exist a vast array of definitions in algorithmic fairness for what it means to be fair. Definitions ranging from disparate impact, predictive parity, equalized odds, to just name a few. But I think there are reasons why these definitions are insufficient, and often they are tailored for classification problems they ignore the underlying data generating mechanisms, the relation between the sensitive variable, the outcome, and other variables involved. And they're also not adaptable to use context-specific information. They don't pay attention to what is the outcome, how is it defined, in what context is defined. And they also ignore the role of domain experts. It's this often one-fits-all definition, and I don't think we can do that. And we as researchers and data scientists are not equipped well enough to answering this complex question on our own. I think a desirable definition should be non-parametric in the sense that our definition of what it means to be fair shouldn't really depend on whether the outcome is binary or the outcome is continuous. And we also should be listening to the underlying relations, how sensitive variables are related to the outcome, to other variables involved in the model. And it should also be a context-specific information, and it should keep experts in the loop as well. So with that in mind, we try to come up with a better maybe notion of fairness. So here we're looking at a passage from a legal expert. It was a case in racial discrimination in hiring, where the judge was asking this question: would the employer have taken the same action had the employee been of a different race and everything else had remained the same? So this is a counterfactual question, really, right? Like, what would have happened had something else been different? So if we would try to mathematize this passage, what do we need to do? So on the left-hand side, on the right-hand side, there is a graphical representation of some of the relevant variables that are involved. So X denotes here the sensitive variable race. We have some baseline information, maybe like age, sex, and we have some characteristics that are influenced by these baseline variables and race that are also could be predictive of the hiring status. For example, level of education, years of experience, etc. So a hypothetical experiment that could convey an answer to this question is the so-called name swapping experiments, where we look at resumes of applicants and change their names from African American sounding names to Caucasian sounding names and vice versa, and then see if the hiring decision changes or not. So here we are looking really at the perception of race. So let's say X equals to 1 denotes the African Americans and X equals to 0 denotes the Caucasians. So then a scenario that would correspond to hiring a Caucasian with characteristics of a Caucasian, but with African American sounding name, corresponds to this nested counterfactual Y1M0. This 1 here denotes the African American sounding name in a hypothetical scenario where the name was an African American sound. And M0 basically says that we are looking at the characteristics of a Caucasian person. So then what would be the potential outcome in this scenario? And then a scenario where we are looking at hiring a Caucasian with characteristics of a Caucasian and with the Caucasian sounding name corresponds to this potential outcome Y0. And if we contrast these two potential outcomes on a mean scale, we get a population level sense of whether there was whether race was affecting the hiring decisions or not. And it's very interesting because what we are really doing is manipulating the effect of race on hiring through this direct mechanism and really keeping the characteristics unchanged, or keeping this indirect mechanism unchanged. So this kind of so based on this this example, then the question is, so is the direct effect of race basically, or the direct effect of sensitive variable, the notion of unfairness that we are after? So here's an example. Before I proceed with that answer, let me just say that, okay, these are also counterfactual quantities. As I mentioned earlier, we need to define a causal model and then a statistical model to use observed data to estimate these kind of quantities. And I'm not going to go over the identification, assumptions, and estimation, but there's a huge literature in this topic as well. But then, okay, going back to the question of, is direct effect the notion of unfairness that we are after in? So here's a toy example where, again, the outcome is hiring status and the sensitive variable is now sex. And the mediator of interest here is some physical fitness indication. So if you're hiring a firefighter, so we know that we agree that sex shouldn't directly affect the hiring decision. But if you're hiring a firefighter, then the indirect mechanism, the effect of sex on physical fitness, could be something that is perceived as permissible and and something that is allowed basically. But then if you are hiring an accountant, then this indirect mechanism is irrelevant, as is impermissible. So then the question that whether it's about direct effect, this notion of fairness is no. And this simple example also illustrates that the definition of what it means to be fair should be very context specific, in what context we are asking this question. But then is it always about direct and indirect mechanism? So let's look at another example where the outcome is some health risk score. The sensitive variable is race, and we have now two mediators. The first one is whether individuals have access to insurance or not, or what kind of insurance they have access to. And the second mediator is some sort of complications and comorbidities related to their health. So in this example, there are 4 different mechanisms through which race could impact the health risk calculations. So maybe depending on the context, only the mechanisms related through which we are looking at complications and comorbidities is something that should be permissible and relevant. But other mechanisms, for example, whether individuals have access to insurance or not, or what kind of insurance they have access to, shouldn't really matter for health risk calculations. So then this notion of unfairness basically corresponds to finding the effect along the impermissible mechanisms. So if we can define the effect along the 3 mechanisms combined, and it's going to be a complicated counterfactual quantity. But then at the end of the day, these are also, we can, under some assumptions, we can write them down as a function of observed data and estimate them. So this illustrates that we're really generalizing the notion of direct and indirect effect as a measure of fairness to past specific effects. So the idea behind past specific effects is that we are really looking in, we are comparing 2 different scenarios. One is looking at the pathways of interest, and the sensitive variable is behaving as if it was evaluated at a specific level X, and along all other pathways, it behaves as if it was something different. So the notion of fairness for us is really thinking about the effect of sensitive variable on the outcome along unfair causal pathways. So then the question is, what pathways are fair and what pathways are unfair? And that's where the domain is, and that's where we are bringing in experts basically. And it should be really a domain specific issue. And I think it's really a feature, not a bug. As I said, I think fairness notion should be very context specific, and we should keep experts in the loop. And this is where it becomes clear why that is. And there's a huge literature also on discussing identification and estimation of these kind of counterfactual and causal estimates that I'm gonna skip over. But what I'm also interested in, how we can use these ideas in algorithmic fairness to assess racial disparities in public health applications. So a lot of the times what happens when people think about disparities in healthcare is thinking about differences in outcomes between different racial groups. But I think we should be asking a different kind of questions. For example, if you're interested in the effect of race on some outcomes like readmissions, bounce backs, etc., we want to know how much of that effect basically are related to differences in socioeconomic status, differences in access to insurance, differences in care. So the kind of questions we should be asking is a counterfactual question. We want to know what would have been, for example, the readmission rates of African Americans had their access to care was as if they were Caucasian, or had their access to insurance was as if they were Caucasians, and vice versa. These kind of counterfactual questions are kind of like, I think what needs to be asked in order to design interventions that could target basically these disparities better. So it's all like the missing data ideas is also a very complicated thing to understand different mechanisms. For example, we have complicated relations between demographic, of course, but aside from that, when the patient gets admitted to the hospital, there are a lot of preoperative measurements that get collected on them. And if they go, for example, under surgery, there are a lot of intraoperative measurements. And then once they are released, postoperative measurements that leads to the final outcome. So there are a lot of intricacies here and complicated relations. But it shouldn't really prevent us from asking the different type of questions. It's just like, again, understanding disparities is just about understanding the mechanism through which race affects the outcome, and try to use that information once we look at the effects to inform us in what kind of policies and intervention we should be adopting. Okay, I think I'm coming to the end of my talk. I just wanted to point out to two different tutorials that you can look at. One related to the fairness that I gave at the two different venues at GSM the year in 2022 and a different venue in 2023. And there's also a missing data tutorial that I presented at American Causal Inference Conference, which was actually happening in Seattle last week. And I'm also going to do that in UAI conference, the Uncertainty in AI. But I want to use this opportunity to advertise for this workshop that we are organizing in Barcelona as part of the UAI conference. The abstract submissions are at the end of May. We are asking for a 2-page abstract. So if you are interested in, please consider this, and please let your network also know. And so here's my concluding remarks. I think in terms of thinking about confounding in observational data, there are a lot of limitations in traditional methods in order to deal with unmeasured confounding. And I think that graphical models are very nice tools to guide us through those kind of complications and limitations. And there's a lot of interesting problems in causal inference. I only talked about simple average treatment effects, average causal effects. There's many different types of causal estimates that we could be interested in. There are a lot of interesting problems, both in terms of identification as well as estimation. How do we incorporate machine learning models into the pipelines? And there are a lot of interesting problems. I'm very excited about missing data as well. It's just I think, having worked in causal inference and missing data problems, I feel like even though they say they are similar problems and they can be exchangeable, but I feel like missing data is a much harder problem. But with progress has been made in order to use some of the graphical modeling ideas from causal inference to advance some of the theories in identification and estimation in missing data. And then lastly, when it comes to algorithmic decision making, I think there are a lot of care that we have to be aware of in terms of not perpetuating some of the biases that already exist in data when we are training these models and when we are deploying these models in practice. And I didn't get to talk about what happens. So, okay, once we agree on a specific notion of fairness, then how do we mitigate them from our statistical training procedures? There are a lot of interesting areas of research there as well. And I think the way I think about causality is just like how it enables us to reason counterfactually, and it comes up a lot in dealing with different types of problems. I think like missing data and algorithmic fairness being one of them. It's just like how a lot of the times our reasonings are counterfactual, and how these could actually guide us in better formalizing the problems and making some progress in these sophisticated situations. I think there are packages in different for different tasks. My student is working on developing this package in R for doing causal inference using graphical models with hidden variables, unmeasured variables, and as well as a Python package that my lab mates back in my PhD times are also developing called Ananke. It's then named after the Greek goddess of necessity and causality. These are cool stuff. Look into it. We're always looking for feedback. And let me just end by saying that I'm always looking for highly motivated graduate students to work in these areas of research with me. So please feel free to reach out anytime. Thank you. And there are any
Thank you,
questions.
Razieh. This was a fantastic talk. I will ask the audience if they have any questions. But just one, I had one overarching question, and I think this is a question I'm probably going to ask Miguel tomorrow as well. So in determining the causal relationship, it's something that I personally struggle with a lot is, what is the correct causal model? And it's usually a very collaborative process. You go with subject level experts, especially, in that like fairness DAG that you showed. that you had the mediators, you know, one of the tricky things is like deciding, is it a mediator or is it effect modifier? And this is usually an assumption that you make. And because this is, you know, the graduate student conference, and I think, you know, a lot of times when you read the literature, everything is like beautifully presented to you. This is the DAG, I'm going to solve the problem. And I was wondering if you could maybe describe a little bit about your process in kind of determining the DAG, specifying the problem, and then taking it from there. Because I think those are usually some behind the scenes work that that not everyone sees, and it might be daunting and maybe even frightening to someone who's starting their career. And you know, it's like, where do I start? So so maybe if you could just like kind of describe that process a little bit for the audience, while people gather their questions. So
Yeah, thanks, Sarah, for the question. I think, yeah, there are a lot of nice things about using graphical models, and it's especially in collaborative work where you can just like draw edges and vertices, and people are very happy about it, rather than just like talking about very dry set of independence restrictions between variables. But then again, yeah, as you pointed out, so how do we know the underlying mechanisms in a way that we can actually correctly specify the causal graph as well? But I think there are like typically two different directions, or could also one could combine both of them in some settings, one being like the whole literature on causal discovery and structural learning, when we are trying to use data to reason about the relations between variables as well, and as well as just using expert knowledge being one of them. It's just like how do we, and then combining them is just like how to use expert knowledge with these causal discovery methods to come up with a better representation. But there's also a lot of the times like what we're interested in is just like timed order. So it's just like we know past causes future, but future doesn't cause past. So it's just like different combination of data-driven methods and expert knowledge to come up with a structure. But then at the end of the day, yeah, we may not be able to all agree on what this model should be. So there's a lot of uncertainty surrounding maybe part of it, or maybe the entire thing. And I think that's fine. For example, then there are other ways to approach it, like sensitivity analysis being one of them. Okay, so if I have a structure where I'm not sure, or if I talk to the expert, they're not sure whether there's an unmeasured confounding here or not, or what this specific relation is, then I'll just model that directly and try to reason that with either making the model more restrictive, or just coming up with a framework for sensitivity analysis to what if the relations were this way versus the other, or what if there was an unmeasured confounder here or not. And I think so far is the best we can do here is just to model the graph using these data-driven methods along with expert knowledge, and just try to model uncertainty surrounding those type of procedures. But yeah, there's also a lot of people who don't just ignore the causal graphical model and think about independence restrictions as well, and that's something we can do as well. But they're all kind of equivalent.
thank you.
Yeah.
Any questions from the audience?
I have a quick question. Thanks, Razieh, for a great talk. So I'm wondering, you know, in this idea of, and Causal's not quite my area, but just wondering about like using these algorithms with like that compass algorithm where it's, I don't know if its outcome is like predicting, you know, like recidivism or like that's like that. Just wondering about even in like using that algorithm in the first place, because like conceptually I can think of, you know, if like it's determining my cancer risk, you know, I feel very comfortable using an algorithm comparing me to a lot of people. But if it's trying to like predict my behavior, it's like also, that's also very interesting to think about like the fairness in using the algorithm in the first place. So I guess, yeah, just like wondering a larger question of like, are there differences in like the kinds of places that will try to use an algorithm to judge this criminal justice stuff versus places that won't, and whether like that becomes a question of fairness as well?
Yeah, I think thanks, Hannah. I think like that's just it relates to what I mentioned in what context we are using algorithms for the decision making. Like, is it predictive decision support, or is it just like the entire thing is automated, or versus we're just like using that to give some insights to the person who is making the final decision. And I think like it's just like almost impossible to for the case where we are just like using model outputs to kind of guide decisions for the judges, for example, in this criminal justice example. What I think so I'm not sure about the complexities that goes around like how people adopt these in practice, like the legal people, but I would just advocate with my naive knowledge of the entire system for automating the entire basically decision making. But then there are also complications there because we have like an outcome of interest that we are trying to optimize for, or this utility function. But what is a good notion of utility is that that's a very complex problem as well. But I'm not sure what the best answer is here. Yeah. But it's just there needs to be a lot of call for attention as well. It's just like, okay, we're using these risk assessment tools, but then under what constraints we have to be utilizing them, basically. And there are a lot of interesting, at least from a statistical point of view, of just like how we would go about implementing that constraint in a way that would lead to lesser bias. For example, if you're just from purely a statistical point of view, like if I'm just like making solving a constraint optimization problem using parametric models versus if I want to be more flexible and just like try to mitigate that biases by just like using non-parametric models. So yeah, I think I'm not sure if it answered your question, the answer you were hoping for, but I don't think I have the the answer.
Thank you. We actually have 3 more questions. Yeah, thank you, Hannah, for asking that question. We have 3 more questions. So just in the interest of time, I want to make sure that everyone has an opportunity to have their questions answered. And we have 3 more minutes. Thomas Johnson asks, are selection models and pattern mixture models preferred in the context of causal inference for missing data, or are other models preferred?
I'm not sure if I get the question. So
Yeah.
are pattern mixture models preferred in the context of causal inference for missing data?
So they actually are selection models and pattern mixture models. So I'm not, I guess they're referring to, not ignorable missing data. And I think the question is, like, are there methods outside of these like 2 classical streams of thought that would be, that you find appropriate? And Thomas, please correct me if I misunderstood your question.
Yeah, I think like well, I'll try to answer this question based on my understanding. But correct me if I'm getting the question again wrong. But so looking into missing data problems from a graphical point of view, so there are a lot of challenges in terms of just identifying the underlying distribution as a function of partially observed data. And we have to be looking into like different parameterization of the underlying distribution and also the partially observed data. And pattern mixture model sometimes can help us there to kind of like gain some insights and just like what parameters could be recovered or not recovered from data. And so but then in relation to causal inference, like a lot of the times the question, the initial question of interest doesn't have to be a causal estimate. It's just like we could be interested in a coefficient in a regression model, and then we have this problem of missingness. But there, so in real, what I'm trying to say here. So there's this like non-ignorability assumption when we are interested in causal estimates. But then in addition to that, we could have missing values for different parts of the variables involved in the model as well. So I just like want to separate these two questions. So if you're interested in the causal question, then and we have missing data on top of that. So the way I like to think about it is just like, okay, so I have this causal estimate of interest. Let's ignore missing data. Can I write it down as a function of observed data or not? And if it can, then now I add this missingness as another layer of complexity. Can I, again, use observed data to answer this question on their missingness, not a random, for example, model or not? But then if I'm not interested in the causal estimate of interest, if I'm interested in some function of the distribution, then it is just it's the same question. It's kind of like I wouldn't need ignorability because it's not a causal estimate of interest, but then the second layer of complexity still is there, like under what assumptions I can actually recover that parameter that I'm interested in. If I was totally off, please let me know, but yeah.
Thank you very much. Unfortunately, there's 2 more questions in the Q&A that we didn't get to. Razieh, if you could kindly answer these 2. I wanted to first read the one in the chat because I didn't know if everyone had access to it, but if you would be able to answer the questions in the Q&A, that would be fantastic. We've already gone 1 minute over, so I will pass the floor to the next session. But thanks again. This was a fantastic talk. If anyone has any further questions, please do type them in the Q&A. And enjoy the rest of the conference, everyone.